I'm frequently asked, for a woman, how many urinary tract infections are too many? Oftentimes, my answer is, well, if you're the one getting a urinary tract infection, I would say probably one UTI is too many. But what they're really asking, in all seriousness, is about when should I be worried about the frequency of urinary tract infections? And for that reason, we use a definition of frequent urinary tract infections, or we use the word recurrent urinary tract infections. And we actually use a very specific definition of 3 or more infections in a year, or 2 or more urinary tract infections in 6 months. It's important to remember that when we talk about urinary tract infections, what we're talking about are symptomatic urinary tract infections, meaning a urinary tract infection is having bacteria in the bladder while having symptoms like burning or pain with urination or much more frequent urination. But when a patient has these symptomatic urinary tract infections 3 or more times in a year or 2 or more times in 6 months, they're said to be recurrent urinary tract infections. And we actually evaluate patients with recurrent UTIs a little differently than patients who have less frequent infections. Oftentimes, we want to check and see, is there some kind of underlying cause? So in some instances, we might actually look at kidney function. Oftentimes that can be done with an ultrasound or even sometimes a CT scan to check out the kidneys to make sure that they're draining effectively, that we don't have any abnormalities of the kidneys or stones in the kidneys. In some cases, we'll even take a look into the bladder with a small scope called a cystoscope. This is often done for women who may have very, very frequent infections that are sort of stacked one on top of another, or for women who have a previous pelvic surgery that might be leading to the infections. But in both of these instances, it can be very helpful to see if there's an underlying cause. Interestingly enough, even in recurrent urinary tract infections, most of the time, we actually don't find an abnormality of the kidneys or an abnormality of the bladder. And it turns out that it might be that one of the most frequent contributors to urinary tract infections are actually the antibiotics that we take to treat urinary tract infections. What I mean by that is that it is normal and healthy for a woman to have certain types of bacteria in the vagina and certain types of bacteria in the bladder. And furthermore, we find that if something happens to these normal, healthy colonies of bacteria, it can actually negatively impact bladder symptoms and may even lead to more frequent urinary tract infections. And so it might be that while we have to take an antibiotic sometimes to treat an infection, just taking that antibiotic may make it more likely that we get another urinary tract infection. So you can imagine how a woman would sort of get into a cycle where she would get an infection and take an antibiotic that would lead to the next infection, for which she would have to take an antibiotic again. And this can be a really, really frustrating cycle for a lot of women. Luckily, there are a lot of things that we can do to help to break this cycle that don't always involve antibiotics. There's some over-the-counter medications. One medication that's been studied is D-mannose, again, an over-the-counter medication that can be taken that can really decrease the likelihood of getting an infection. There have been other studies on probiotics, and this may help to restore those normal, healthy bacteria. Some women, in conversation with their healthcare provider, it turns out that they have thinning of the vaginal tissue that can occur as a result of menopause. And so some women will be prescribed a vaginal estrogen cream, and that can help to reduce infections. Every now and then, we have to resort to placing patients on a low dose of an antibiotic for some amount of time. But the problem is that's not really a very good sustainable therapy long term. But just to summarize, we normally think of recurrent urinary tract infections are those that are happening 3 or more times a year, 2 or more times in 6 months. Those are the patients that may need a more formal evaluation to look at the kidneys and look at the bladder. And oftentimes there are a lot of things that we can do that would reduce the risk of having that next infection.